Yeah, so thank you to the course directors for inviting me back. They originally said 5 psychologically complex patients, but I knew there was no way I could get through that in this amount of time. Psychologists talk too much. So we're going to talk about 3 psychologically complex situations when people are trying to lose weight. I have no disclosures. We're going to talk about eating disorders, addiction, and trauma history, and how they can affect the pre or post weight loss intervention trajectory. We're going to do this case-based, so we're going to start with the first case. This is a 59-year-old transgender female who is 2 years post Roux-en-Y gastric bypass surgery. BMI is 23. Unfortunately, she had a pretty significant childhood trauma, sexual abuse history, and we were really familiar with that. She also then had an eating disorder history in adolescence. We were less familiar with that, unfortunately. And her post-operative course was pretty complicated in that she had really chronic nausea after surgery, kept coming back with complaints of nausea, more than we would expect. She had lost weight to go through gender-affirming surgeries. And so after she had lost some weight, she had a series of gender-affirming surgeries. And we were starting to hear about difficulties inpatient with she didn't want to eat what they were recommending, and the dietitians inpatient she felt like were being too pushy and pushing food on her. And so over time, the team, we began to learn that the patient really had a very limited food repertoire, really had not gone much beyond soft foods after that stage post-bariatric surgery. Started revealing that she was walking 20,000 to 25,000 steps a day. She eventually revealed to me that she was drinking a large bottle of milk of magnesia every day. So this is probably where the nausea is coming from on a Roux-en-Y anatomy, and that she would water load prior to weigh-ins so we wouldn't notice how excessive her weight loss was. So that leads us to our first question. What is the prevalence rate of eating disorders following bariatric surgery? 5%, 10%, 25%, or unknown at this time? All right, let's see what we said. Okay, yes. Interesting, good 2 choices. It actually is unknown at this time, but I can kind of see where you get the 10% from. I need to stop clicking it, I think, right? There we